U.S. has more than 180,000 deaths from coronavirus, so you might be surprised to learn only 6% of those victims had COVID-19 listed as the only cause of death, according to the CDC. ABC 10 News reporter Jared Aarons is going in depth with the experts to cut through the clutter and misinformation that report is creating.
If you've been on social media in the last week, chances are you've seen an article like this about a CDC report as proof that the coronavirus isn't as deadly as the numbers initially said. But experts tell 10 News the CDC numbers in that report actually show that all these other causes of death are either pre-existing conditions or side effects of COVID that show how bad the disease really is.
This is pretty new. We're all working to figure out how best to take care of people.
Dr. Amy Bellinghausen works in the ICU and recovery at UC San Diego Health. She's seen firsthand how COVID-19 devastates the body. Dr. Bellinghausen says the CDC does a great job of explaining causes, but the confusion comes from people misinterpreting data called ICD-10 codes.
Those are, again, just written down by doctors or other providers on the death certificate, trying to explain what was the sequence of causes that led this person to die.
According to the CDC, more than 20 other ICD-10 codes have been found on death certificates with COVID. The most common, flu and pneumonia at 42%, followed by respiratory failure, hypertensive diabetes, acute respiratory distress syndrome, and cardiac arrest. Dr. Bellinghausen says most of them are complications of COVID-19, which people didn't have until they got the virus. It's more proof that coronavirus is a killer.
The reality is that this infection, coronavirus specifically, can be so overwhelming and cause so much inflammation in the body that it causes other organ systems to fail. And often that is ultimately the cause of somebody dying.
Dr. Bellinghausen says a better way to see COVID's deadly impact is the CDC report on excess deaths. The yellow line on this graph shows how many Americans the CDC expects to die in a given week. The blue bars are the actual number of deaths. The spike over the yellow line started in March as COVID spread.
And you can see back in 2018, 2019, when we had a really bad, really long flu season, you can see the excess deaths go above that curve of what was expected. And unfortunately, coronavirus is kind of blowing that record out of the water in excess deaths this year.
Bottom line, while the CDC does say only 6% of coronavirus deaths were from COVID alone, the virus either caused or worsened all of those other symptoms that led to death, underscoring how deadly and dangerous it is. Jared Aarons, ABC 10 News.
Dr. Bellinghausen says the best thing people can do is look at the original report before believing what any article tells you. We have put links to all of the CDC reports on our website, 10news.com.